Hi, welcome to What We Wish We Had Known. Today we're going to be talking about masturbation because May is Masturbation Awareness Month.
It's International Masturbation Month. Oh,
International Masturbation Month, and it's Mental Health Awareness Month. And so we're going to be talking about masturbation and mental health and how, when we were general therapists, it wasn't really something, well, for me, it wasn't something that I talked about at all, was people's masturbation habits. But as I became a sex therapist, it did become something very important to ask about. And the way that it came up has been different for each client. There's in our sexual history assessment, I do ask about it, but there have been other ways that it's come up during sessions as well. And so, Sari, for you, how has masturbation and mental health come up in your work as a sex therapist?
well, as the late, great pioneer, Betty Dodson would call it, solo sex is a really important item and topic to discuss with your clients because even if they come in individually, because we want to know, first of all, how they were first introduced to it and how they were first how it was first reacted to by the people around them, because as we know as certified sex therapists, like, people have a lot of shame around sex in general. Well, that shame will have a lot of times started if they were self-pleasuring or self-stimulating, and one of the parents comes in, if they're a young child, and that reaction of that parent or caregiver can be the seed of the initial shame, right? Because if they, I have a client who used to get her mouth washed out with soap every time she was discovered to be self-stimulating at age, 4,
Mm-hmm.
which is, it's a natural thing that children will be exploring. Um, and so that deep shame doesn't just go away, even when you become a sexual being in a partnership. So that's another way it comes up, right? We want to understand kind of the seeds of shame.
Yeah. I'm glad that you brought up like when she was younger, right? Because a lot of people don't realize that a part of a child's development is they do discover that part of their body.
Mm-hmm.
And for them, it's not something sexual. It's just, this feels good to touch. It feels like, and they don't have the awareness of this is something sexual, how we think of things as sexual and turn-ons and
Right.
arousals. And so there is a lot of shaming around that, or saying things like, get your hands out of your pants, why would you do that? Or and recently, over the past couple of years, I think there has been more discourse around how do you talk to your child about doing this without shaming them so that they don't
Mm-hmm.
have this response. And I think that's really a positive thing, because it is something that comes up a lot for me during our sexual health, sexual history assessment, is what was that like, if you did have that type of experience, what was that like? And another thing that comes up is, especially for millennials and younger, the internet came out right when we were like 14, 15, 16. And it was, we talk about now like unfiltered internet, but at that time it was even more, because we didn't know everything that was out there. And so people being caught looking at porn, or being caught in chat rooms, or being caught
Mm-hmm.
on like engaging in, and this is a little bit different, but like engaging in cyber sex activities, and then being shamed
Right.
for that as well. And then that impacts them as they get older, as this is something that I need to really keep to myself and be very, very secretive about.
So, and in addition, I would also add that one of the other ways which it's helpful to understand is that if you, first of all, let me just say that if you're born in a cis male body, the way people react to your self pleasuring is can be totally different than the way they react if you're a cis female body,
Mm-hmm.
because that's considered playful, or boys will be boys, or isn't that cute, right? And if we fast forward, we know that women tend to have more difficulty achieving orgasms in partnered sex. The orgasm gap is still very much alive and well for cis heterosexual females. And so we want to understand for them how they feel about self-pleasuring, how they feel about their own genitalia, even because they come from a place that if they've had a partner or even as a child, someone tell them that their genitals are ugly or disgusting, right? They will then own that as a self-identity, and their sex esteem will be quite low. So the other way in which talking and asking about someone's masturbation journey or self-pleasuring journey is to find out, A, the shame piece, and B, are they self-pleasuring now? Because we also know that it's a way of self-discovery. So if you don't know what actually makes you tick and what actually stimulates you, then how are you going to bridge that to a partner or express that to a partner?
Yeah, I think that it's something that comes up in sessions now, especially when there is talk of like someone has a lower sex drive or they're not experiencing any desire. They're describing it as like, I don't know how to get turned on. Maybe I'm feeling a little bit aroused, but I don't feel that like psychological stimulation. Something that I bring into sessions is talking about like their erotic map and discovering their own internal or individual sexual experience and what that's like for them. Because a lot of people have this idea of, yes, I have like some people, I do masturbate and I have like a healthy relationship with masturbation, but other people are like, well, I just don't feel that desire to do that, or I don't even know where to start, or I don't know what to do. And they think of masturbation as like maybe they're just watching some sexually explicit media like porn, and that's the only way they can relate to being turned on, and thinking about, okay, maybe because that doesn't work for me, maybe I can fantasize about something, or I can read something, or I can listen to something. Those ideas don't really occur to them because they only know it from one lens. So in our sessions, when we're doing this and we're talking about how do you masturbate, or if you don't, like, why not? What are the things that you don't like? And discovering your own erotic map through talking about different ways that you could engage in solo sex.
And certainly if you people who don't who may have a practice but they don't necessarily have never shown their partner what feels good to them, and they have this sort of fantasy about, well, they should just know, whatever their gender is, my partner should just know. It's kind of obvious, based on kind of the signals I'm giving them, the nonverbal signals. Well, it's not obvious. Everyone has a very, unique, their own style of what makes them feel good. And unless you recover from the initial shame and learn the skills on how it feels good, you actually have to demonstrate to your partner. Right. And so solo sex is a way of building up your own understanding of both of your erotic and technical, if you will, technique, and then being able then to share it with a partner, which a lot of people have a difficult time because they feel embarrassed, or they feel like the other person should just figure it out.
Yeah. Something else that comes up is, when we're talking about some erectile disorders, or we're talking about delayed ejaculation, we'll ask them about what is your masturbation style, right? And that's just to get an idea of, especially for delayed ejaculation, how are you masturbating, and does this translate to partnered sex? And maybe that is a cause for why you're experiencing this delayed ejaculation. That's something that before becoming a sex therapist and learning about that, I would have never thought to ask, or I would have never known to ask, right? That's something that we learned through screening is you want to know about specific like ways that they're masturbating, how to ask those questions, which you could feel as a therapist that doesn't have much experience talking about sex or talking about this, that can feel embarrassing or shameful to you to be like, well, why would I ask about like how they're masturbating? Why is that important? And then being able to explain that to a client of why it is important and why you are asking that, just as for like transparency in the therapeutic process. And that is something, like I said, I would have never thought to ask or how to ask when I was a general therapist.
Right. And for those of you who are watching who aren't familiar with this term, delayed ejaculation is the experience where a person with a penis has difficulty coming to a climax, or maybe never comes to a climax. And certainly the more common way that is presented is with a partner and in penetrative sex. So maybe they can bring themselves to orgasm during solo sex, but because they have a kind of a unique style of masturbation or self-pleasuring, it doesn't translate well to any type of penetration because the biofeedback, what we call like the body-mind feedback loop, is not the same. They've trained themselves to feel a certain way. And I guess the other thing that I think that a lot of therapists might feel is like they're being intrusive, right? We grew up from a young age, are being told this is a private thing you do in private by yourself, hence the name solo, right? And so for a therapist then, to think about asking a client about what they do in private seems almost, impolite, if not downright intrusive. But, as you said earlier, right, we are very transparent in the way we work with our clients, and before we ask them the question, we'll say, here's why we would like you to ask, we'd like to know this, the answer to this question. We are trying to help you either address your lower drive or desire, or we're trying to find out why you may or may not have difficulty coming to orgasm or even getting aroused. Like we're doing the detective work, and so we need to ask you these questions. And if you don't want to answer, that's fine, right? There's always an opt-out, consensual non-consent, right? Like they may say, I don't feel comfortable at this point telling you. And that's also fine, right? Whereas I think, the general choice that general therapists do is they just don't ask, and they don't know why they would ask. And which is why our certification is called See It, because if you don't know what to ask, and if you don't ask, you won't see it. Right?
Yeah. As we wrap up, I want to ask you one question. If you could, as yourself today, with all the knowledge that you have, go back and visit yourself, let's say 10, 20 years ago as a general therapist, I think it was more than 10 years ago. So as a general therapist, what is one important piece of information that you would want to tell younger Sari?
I would want her to know that it is okay, and actually it's kind of critical to find out from your clients about their sexual lives and whether it's with themselves and or with their partners, and not to wait for them to bring it up. That's like the main thrust, the mission here is don't wait for your clients to bring up their sex lives. It's a part of one's identity. It's part of one's mental health, right? It's Mental Health Awareness Month. So that's the big take home, I would have given myself. What about you, Kelly?
Similar that it's, it is important to ask and engage, but also that like reminding myself that you're not being intrusive, that you're not, as long as you're asking permission and you're engaging them with the conversation and you're, seeking that safety for them so they feel comfortable, that this is an important part of the therapeutic process and it's okay. And you don't need to worry about like, is this impolite or is this intrusive or am I asking this? Like you know, am I asking this and it's going to make them feel a certain type of way?
Mm-hmm. Mm-hmm. Yeah. Well, thanks for this discussion, and I hope you guys, you who are watching it, have kind of gleaned some insight as to what we wish we had learned earlier and why we're so happy with our work now and feel like it's much more complex, multi-layered, thorough, and actually, therapeutic.
Mm-hmm.